I will now call this Board of Health meeting to order, June 28th, 2024 at 10 a.m. And I would ask to have the roll call done, please.
Sue Carlton.
Present.
Luke Charbonneau. Luke Charbonneau. Luke Charbonneau. Brian Milne. Brian Milne. Brian Milne. Kevin Eccles. Kevin Eccles. Kevin Eccles. Chris Peabody. Chris Peabody. Chris Peabody. Sue Patterson.
Present.
Helen Claire Tingling.
Good morning, everyone.
Kenneth Craig.
Present.
Nick Saunders.
Present.
Chad Richards.
Present.
And Beverly Wilkins.
Present. Thank you. Amendments to the agenda. We do have some items to amend in the in-camera session. For item 11.2, we will be adding other related matters there. Under the AMOH, where it says during parental leave, AMOH recruitment update and other related matters. And then the same under board evaluation results discussion, we will have other related matters there. There's one more item to add under 11.3 for legal, and we will be removing 11.4. Everyone is okay with those amendments. I will ask for a mover and seconder, the recommendation being that the agenda be approved by the Board of Health as presented. Beverly, and seconder, Chad. Any discussion? All in favor? That is carried. Pecuniary interest. Is there any that needs to be declared for pecuniary interest?
I'll declare it in camera.
Okay. Seeing none, you may declare it any time throughout the meeting if that becomes necessary. Item 6 is adoption of the minutes from Friday, May 24th, 2024. Recommendation that the minutes be approved by the Board of Health as presented. Could I have a mover and a seconder, please? Nick and Sue Patterson. Any discussion on those minutes? Seeing none, I will call the vote. All in favor? That is carried. Moving on to correspondence and media releases. Dr. Eric.
Madam Chair, the correspondence list has one item, and it is a letter from the Alpha Chair to the Chief Medical Officer of Ontario. It's related to the review of the public health standards that is being undertaken at this point. And the main point in it is the width of the standard could require the same budget or even more budget than that we are assigned to HealthUnit at this point. So the call from the Alpha Chair is to consider adjusting the budget accordingly, or to ensure the budget for HealthUnit meets the standards and expectations from them. I didn't put recommendations just because I thought it's worth discussion at this board specifically. I'm 50-50 around endorsing versus receiving. All health units have the opportunity to weigh in on the standards, and we have done our part, and that's one of the things that we usually health units consider. The whole review of the standards to adjust the standards to the budget, or budget to the standards. So this will go from different entities to the ministry directly, and we can send our own letter, or we can endorse this letter, and I don't see, I see both approaches as effective, and I thought I would ask the board for your direction on this.
Okay, I will turn to the board. Any comments from anyone or any thoughts on this? seeing anything. So what you're asking on this one, Dr. Arrow, just
So specifically, we can endorse, and that's would augment that letter and send a message. If we receive only, my recommendation would be to write our own letter requesting the same consideration. It would be more efficient to endorse from that point of view.
is everyone in agreement that we endorse the letter from Alpha rather than writing our own?
Certainly.
I'm seeing none, so Ken, go ahead.
I'd like to move that we endorse, we concur with the recommendation and endorse the letter from Alpha.
Thank you. That's mover, seconder. Claire? Any other discussion on it? Then I will call the vote on that. All in favor? That is carried. And moving on to media. Any joining us or on media releases?
I don't think so.
Who's that?
No, I don't think so. I haven't heard from them.
Okay.
So there has been a number of media releases that have been sent since the last meeting, and 3 of them related to investigations for rabies and dog bites. There is an additional blackleg tick established risk area identified, and there is more information on this one in the MOH update as well. But we send it to the public and we send it to partners who deal with the process of investigating Lyme disease. The other releases some of them are related to overdose, opiate overdose that took place during the month, and one of them was fatal. 15 of them happened in a specific period of time, window of time, where there was a threshold sufficient enough to send a media release. We usually send advisories for any one of them, but we don't go to the media release to the entire public unless there is a threshold that is met. And at the frequency that we have been seeing dog bites, we sent a media release to raise awareness about dog bites and handling wild animals, and just in a proactive way to let people know that these interactions can lead to investigations if a bite happened or an injury happened. So that's in general, Madam Chair, the list of media releases. Open to questions as always.
Any questions from anyone on any of those items? Seeing none, then...
May I have a
Oh,
question?
yes, certainly, go ahead.
Through you, the protocol, I am not aware of. If there is rabies, there used to be injections, etc., and then a follow-up, who does that now?
So for you, Madam Chair, excellent question. So the rabies program is based on prevention. As soon as there is a rabies infection and the treatment is effective, it's usually death is the outcome from rabies infections. So it's critical to respond and provide the vaccine. So we provide the vaccine and healthcare providers provide the injection, and we follow up usually 3 to 5 meetings or appointments for more injections. There is a booster effect, as you know. And it depends if the person had the vaccine before or not to go with the number of vaccines. It is the healthcare providers, the hospital, the emergency departments. We have good correlation with the. We do provide the vaccine, and we do provide support in assessing the risk for the need for the vaccine.
Excellent. Okay. Important, I think, that people know that fact. Because a lot of people don't have healthcare professionals. So therefore, where does the vaccine come from? So that's appreciated, because then when they come and ask, we know. So thank you.
So that does raise a question then for me. How many people would have that vaccine ahead of time, or you get it after?
Most people don't get this vaccine unless they're handling animals. Vet technicians, people who work with recommendations, are not such a certain requirement to have the vaccine.
Okay, that's interesting. I did not know that before. Okay. Any further questions there? Helen Claire?
Thank you, Madam Chair. Through you, I had our first bat in the house 2 days ago to deal with, and I wondered if Ms. Dr. Ara could speak to the risk with rabies and bats this year. Thank you.
You, Madam Chair, again, excellent question, and it's related to the update that we have under the MOH update. The bat as a reservoir for rabies is the most important one in Grey Bruce. So we don't have raccoons that have been infected over the past year. We screen for that. We screen for other sources. So bats remains number one, and we have not had a case of rabies in Grey Bruce or Canada for years. But that is because of the proactive screening for these cases or exposures. So we do have a higher number the highest number actually of animal and dog bite in the province, and by virtue of our geography and the summer tourism and many people who come from big city interested to pet the wild animal, and they realize that that's not a wise decision after. And we do communicate to the public on this. So again, in short, it is the highest source of our concern, interactions with bats, and it does happen for many reasons, whether it's locals or visitors, whether it is intentional or somebody wakes up with a bat in the room. And there are protocols or algorithms that assess the risk, including having a bite or scratch or not. Sometimes the bite or the scratch would be not noticeable by a person if they are asleep. So if somebody was asleep and woke up with a bat, we will go to the conservative approach, say you've been exposed. Not sure if that answers the question, Alan.
Yeah, good.
Perfect. If there's no further questions there, the recommendation will be that the media releases be received by the Board of Health for information. If I could have a mover and a seconder, please. Deb? And a seconder? Helen Claire? If there's no further discussion, I will call the vote. All in favor? Moving on to medical officer of health update, starting with 8.1, the opioid situation.
Chair, I'm just logging in to share my screen, and I make it easier to point out. Oops, sorry.
Yeah, but Sam, is it?
That's me.
Oh, is it?
Dan,
So the first two items, Madam Chair, are standing items. There has not been significant changes from the last updates. For the opiates, we continue to work with the partners to deliver the services that we have according to our strategic plan. For the second one, strengthening public health, again, is, as I mentioned in the received the survey, we feel that we send it back to the ministry and other health units have. Number 3 is monitoring food affordability in Grey Bruce. We've presented, the manager presented to the board on this in the past 2 months, I think in May. And since then, one of the tables that had numbers of food affordability was identified as a source of error. There was an error that changed the amounts, however, they didn't change the conclusion of the report itself. So to be complete in quality improvement and the transparency, we thought we'll bring it back to the board, present that table, and it is in the report, if I can just just want to put it on the screen so it's really documented as well. So the table corrected is as so, and the percentage of change was minimal, and it was an error coming from missing on the decimal point. Our team took these following steps for quality improvement. Staff immediately informed the manager and the senior manager. We corrected the report, and we're sending it to everybody who uses this report. The steps also implemented to prevent this from happening in the future, whether by using the specific additional data validation tools or connecting with the data analyst to see how this will be prevented in the future. And again, this is part of the quality improvement, continuous quality improvement that we do, and the transparency. If there's any questions, Madam Chair, can be more than happy.
Any questions from anyone on this item? I am not seeing any, so I will move on to the next item.
So the next item is the tobacco cessation services and that the health provides. So we do provide different services. One of them is to help clients with the consultation related to tobacco cessation and tobacco enforcement, working with school health team to identify the individual who would benefit from consultation and other. And one of these services, which is consultation service itself, will be discontinued, and the clients will be connected with, have been notified and directed to connect with other providers in the area, whether it's primary care or pharmacy or different agencies that help with aspect of health prevention. And the reason for discontinuing it is multiple fold, like as usually most decisions in public health. One is to meet the budget consideration and to tailor our budget and resources to the most effective aspects of the delivery of services. In other words, the number of people who use this program and how many people benefit from it, stop the smoking through our program versus primary care and the delivery of this service from other providers. So, sorry, I'm going in three directions. One of them is the budget, one of them the fact that there are other healthcare providers that can provide this, and we work with all of them. Third one is the amount of work that is being done and delivered. It's quite manageable to spread it on other providers. And the mandate in general for the Board of Health is to ensure the service is provided And the word ensure is key, not necessary to provide it ourselves, rather if we can mobilize the community to provide it, and that's what we did, for example, with sexual health over the past 20 years, to move from providing the service to connecting the clients with the primary care. During the pandemic, that was reversed completely because other people couldn't. With smoking cessation, there are other partners who can do this, so the decision was to gradually move towards that. Open to questions, as always, Madam Chair. There are other considerations, other information about the Ministry of Health increasing the penalties for smoking in schools, or the consequences of smoking in schools. So there has been multiple interventions locally and provincially that would allow us to see this change happening.
For questions, I just noticed in the monitoring food affordability report and this one on tobacco cessation, there is actually a recommendation within the report. Should we be voting on those recommendations individually, or including it all as part of your update? To me, it seems specific that there are recommendations within the reports.
Your recommendation is to receive the report, I believe. At the very top, it's recommendation that the board receive the information for this one. And for the food.
Yeah, I'm just, when I see an individual recommendation, I just want to be clear, should we be voting on the recommendation within the report, or are we all right covering that within all items together?
In general, if all of them is to receive and there is no specific action.
No action
you can
identified?
do all of them together.
Okay. Does the board have any questions on the tobacco cessation report then? Seeing none, then let's move on to the next item.
And the next item, Madam Chair, the proactive questions from the board kind of covered a good chunk of that report, which is related to the vector-borne disease rabies program and the West Nile virus and the Eastern equine encephalitis virus. So zoonotic disease that transfers to the humans through animals, is part of what we do in public health, and the key point summary is the, as listed here on the screen, vector-borne disease surveillance is ongoing and it's used to assess the risk. The risk remains low or very low for rabies or West Nile virus or Eastern equine encephalitis. And again, those are surveillance program, and the fact that there has not been many cases of them does not justify stopping these programs. They are early warning signs for the healthcare system to start testing for these diseases if we identify an increase of the risk in the animal population in the area versus the human population. So it is a very effective way to prevent cases in humans, and it is good news that the risk remains low. For Lyme disease, the tick surveillance has shown that there is gradual increase year after year. However, the risk for Lyme remains very low, and especially for severe complications or so. And I can go in details about each one of them based on what the board asked for. I do believe I covered a number of these for rabies specifically.
Any questions from the board? I am not seeing any. So then the recommendation is that the medical officer of health update be received by the Board of Health for information. Could I have a mover and a seconder, please? Sue Patterson? Seconder? Seconder? Luke? No further discussion, I will call the vote. All in favor? That is carried, thank you. And next is corporate services, 9.1, the financial report. Kim?
Through you, Madam Chair, this is the April 2024 financial update. So as of April 30th, we had a surplus of $215,000. Half of that related to our senior dental program, which is from the leftover additional base funding from 2023 that we carried over into 2024. And then the other half of the surplus relates to our mandatory programs. Year to date, our funding and revenues are in line with our budget. Our salaries and benefits are slightly under budget at around $45,000. We do have some gapping in the position consultant we're recruiting for. Our operating expenses continue to be under budget on most lines. We did renew our Alpha membership in April, so that expense is reflected in our associations and memberships. And our dentist and insurance fees are slightly over budget for seniors dental as we're using the additional funding that we have available. Project for the Walkerton Clinic, so lots of progress continues to be made there. The flooring and painting has been completed. The non-dental millwork was received in early June and was installed. Recently, the countertops, base doors, window film, roller shades, and all those have been installed. So every week, lots is getting done, and we're well on our way.
Excellent. Any questions from anyone on the board about this report? I am not seeing any, so we will move on to the next.
Madam Chair?
Oh, sorry, Helen Claire, go ahead.
Thank you. I'm just wondering, I'm not sure if this is the appropriate time, but just because it had come up about the surplus related to the seniors dental in particular, and I don't think there's enough awareness in the community about public health provision of dental services, and I wondered if there might be an opportunity to speak to that, if not at this moment or even in this meeting, if there might be an opportunity at another meeting to have a presentation on that. I am aware that most provinces and territories through public health do provide dental services to those that don't have insurance. And I just would think it would be great if we could communicate that to the community. Thank you.
Thank you. I think that's an excellent idea. Dr. Aaron?
Through you, Madam Chair, absolutely an excellent idea. We, as public health, we are the victim of our own success. If we do things very well, people don't hear about it. So too much communication is not enough, and we definitely can prepare a presentation on the program and how people can apply to it. I do believe we presented it a year ago or so, and it's always warranted to put it out in public, so we can bring it to a future meeting in the coming, I would say, 2 months.
Okay, very good. Thanks, Helen Claire, for that. Anything else there? We'll move on to the next item, the RBC swap update.
Through you, Madam Chair. So RBC, who we bank with, is looking for us to sign an amended banking agreement for the changes made to our primary reference rate for our bankers acceptance borrowing. So essentially our mortgage on the building, we entered into 2 swap agreements to finance the mortgage on the building. We are locked into fixed rates. And this is more of a global banking change that they're making across the board, where they're retiring one index and moving to a more secure one. It ultimately does not impact us. Our rates are still locked in for the same amortization period at the same fixed rates, but we do have to sign an updated banking agreement where instead of saying they're referencing the VA, that they're now going to be referencing the CORA. So just bringing this here for board approval because it does relate to the financing on the building, but essentially there's no financial impact to us, but it is a bit of an administrative task.
Any questions on this item? Okay. So the recommendation from here is that the RBC swap update is approved and financial report for April 2024 be received by the Board of Health for information. Could I have a mover and a seconder, please? Nick? And Chad? Any further discussion? I will call the vote. All in favor? That is carried. On to other business, 10.1, GBPH's Alpha Resolution Update on Indigenous Health. Dr. Rivera?
So Madam Chair, just to circle back to the board about this update from the Alpha meeting, Councillor Saunders and myself attended the meeting. We presented the resolution for Alpha. Sorry, I just should have stopped the screen. And I do believe it was a very successful presentation. Usually the resolutions in Alpha requires many steps that I can see how the presentation that Councillor Saunders presented had all the elements of it, that the number of questions that was generated was very supportive. The questions were supportive, the statements were supportive. There was a unanimous approach to it. The group tried to build on it for other benefit for the cause itself. Nevertheless, it landed in a very good situation where it is one of the strategic directions for Alpha to support in the coming years through your resolutions, and this is a core one of them. And I really appreciate Councillor Saunders' attendance and presentation. And during the lunch period after the resolution has passed, 7 groups came to our table to consult on how the health unit and the Indigenous community has come to working together in the way we have been working, which is very reassuring that our work is not just only going to benefit great
Hey, not here, never at all.
Very good. Thank you for doing that. Thank you for bringing that forward. I think that's an excellent thing that we can be moving forward and helping in any way that the health unit can. Are there any questions from the board? Seeing none, we will move on to then the annual report.
Chad's got a question.
Oh, sorry, Chad, go ahead.
Yeah, not a question, Madam Chair, so much as just a comment to thank Councillor Saunders for his work on that resolution. And also, I know that when it was brought to the board last time, I had some questions about language, and it looks the final resolution, as I see here, looks just like really substantive, and really addressed the comments that I brought forward. So appreciate you hearing my comments last time, and glad to see that this was a success. Thanks so much.
Thank you for those comments. So, seeing nothing further, we will move on to the annual report 2023.
Madam Chair, the annual report, I'll share the screen again. For 2024 was completed, and it highlights the work that our team and health unit produced over the year, and there has been a number of core strategic directions that we advanced the work on, and whether it is a matrix priority project that would help all these strategic goals in general. The people that worked on it, the people that we served, is one aspect of the report. We have the client satisfaction survey on our website, and we developed this barcode that we usually hand to clients whenever we interact with them, whether through a card or our emails, and it would allow the clients to provide information on the website. It's worth mentioning during the pandemic, the number of calls and feedback or requests increased drastically, that we had to open our lines, hotlines, and some of it is for COVID, some of it is for vaccine for COVID. And after the pandemic, we went back to the online and we started the survey. So the first report, monthly report, goes to the managers, to the programs to respond to any client issues. During the year, the report is generated twice for senior management, and at the very end of the year, there will be a report on the annual report for the board and the public. The programs that are listed here are the programs that functions in the health unit to serve the public environmental health, and there are many highlights about the good work that they do. Foundation Standards support all of them through the Matrix project that I mentioned before. Harm reduction, obviously, is one of the approaches to deal with the opioid crisis and other substance. Health promotion is core function of public health and to prevent disease in the long run. Healthy baby, healthy children is another one, and infections prevention control, IPAC, goes without saying. People during the pandemic have dealt with it with our team throughout Grey Bruce, and people are quite aware of our work there. Infectious disease is a bigger picture for whether it's sexual health or other zoonotic disease and other programs that we have. School health is another program that we focused on after the pandemic to rebuild it and connect it with the schools in Grey Bruce, whether it's the big schools or the private smaller schools. Oral health is another program, vaccine preventable disease. Again, goes without saying, it's a very active program on many fronts. Our partnership, whether with the Indigenous partners, school boards, priority population, and that includes multiple groups, government, municipal, healthcare partners. And there is an aspect for the financial budget for 2023, and the expenses or other aspects of the budget, and that's a snapshot of highlights of what we have done in 2023. It is published on our website, available for the partners as well to inform.
Thank you. Any comments or questions from the board?
Through Chair, I just wanted to say how user-friendly the report is. Snapshot of what programs were in color, accessible, it was well done.
Thank you.
Okay? It really was for staff or whoever. It's very clear. And it's a great selling feature.
Yes.
So thank you.
Go ahead, Chad. I can see your hand is up.
Oh, okay. Yep. Sorry, we lost audio from the room there for a couple seconds, so sorry about that. I just had a quick question. So I agree with Beth's comments. It's the numbers and the way that the information is presented in the annual report is really, really excellent. I'm just wondering if there's an accompanying communications strategy or plan to get some of these figures out into the public sphere, just to build some awareness about what public health is doing. I think it's, while the report is accessible, when you pick it up, not a lot of people take the time to go through and access a public report like this. But I'm wondering if there's ways that we can get this information in front of people where they're at, whether it's a social media strategy to highlight some of those core numbers or those big program pieces that were conducted in 2023. I think that'd be really great to see.
Thank you. Dr. Aaron?
Through you, Madam Chair, excellent question, and this is definitely part of our recovery from the pandemic, to capitalize on the fact that public health is in the spotlight and how we can build on it. And part of the work that was done in 2023 is the communication work on rebranding of the health unit and public health, changing the logo, and they have been and they will continue to use those pieces of information about different programs in different social media and different settings, different packaging vehicles to deliver the message to different population. So this has been happening for 2023, and the report itself as a result of those communications, and it will be utilized as well in snippets of it and parts or presentations to deliver that message, definitely. And I want to send a shout out to our communication team. We have two communication experts, second to none, and they work through the Matrix organization, the Matrix project with all programs, and they support each program where we identify in each program a person who would have the inclination to work on a communication part from their program. So they provide the content from the program. It will be packaged through communication and sent out in the most effective way to the audience for that specific content.
Excellent. Any other comments or questions? Seeing none, then the recommendation is that the update reports be received by the Board of Health for information. Could I have a mover and a seconder, please? Chad and Sue Patterson. If there's no further discussion, I will call the vote. All in favor? That is carried. Thank you. So next we are ready to move in camera. Sorry, for those online, I'm just trying to figure out what my motion is to go in camera here, because we have a few items on the list. So recommendation is that the Board of Health move in camera at 10:44 a.m. to cover adoption of in-camera minutes from previous meetings, personal matters about an identifiable individual, advice subject to solicitor-client privilege, and I think that covers all items. Could I have a mover and a seconder, please? Bev and Helen Claire, all in favor? That is carried. We are now in camera. So that we are back to being recorded. Thank you, Hannah. So I will report that the Board of Health went in camera to discuss only those items that were listed on the in-camera agenda, plus the additions that had been made. That on item 1, adoption of minutes, there was approval given to adopt all of the minutes. Direction was given on items 2.1 and 2.2. And direction was given on 3.1, 3.2, 3.3, and 3.4. And that was all that was discussed when the Board of Health was in camera. So, back to regular agenda. Unless there is anything further anyone would want to discuss, we can now be adjourned. Do I need a motion, mover and seconder? Thanks, Helen Claire. Sue?
Question, do we need a motion to approve the MOH coverage?
We can do that in the July meeting if you wish.
Oh, sorry.
Okay.
Yes,
Okay. I think we are now,
Second.
okay, we are adjourned. Thank you, everyone.